This is a bulletin from the Food and Drug Administration, a CT safety announcement from October 8th of 2009. What this announcement addresses is safety investigation of CT brain perfusion scans. And what they found was that the FDA was aware of radiation overexposures during perfusion CT imaging to aid in the diagnosis and treatment of stroke. Over an 18-month period, they identified 206 patients at a particular facility who received radiation doses that were approximately 8 times the expected level. Instead of receiving the expected dose of approximately 0.5 gray, these individuals had received 3 to 4 gray. If we do an analysis of that in chest x-ray equivalents, the standard examination would be about 840 chest x-rays. That these individuals received was as much as 6,720, and the amount of radiation that's actually received at the facility that I work in for the same procedure is 4.3 millisieverts, which is 215 chest x-rays. So you can reduce the dose very significantly through the use of advanced technology and the type of shielding that I've shown you. But the point here is that in this particular instance, there was an inadvertent use of a very high radiation dose. According to the FDA, there are now at least 269 patients in a subsequent bulletin who received a successive radiation dose at a facility in California. Another 37 received radiation doses at hospitals and other facilities in the United States, so that this was not occurring in only one location, but something that has actually happened, unfortunately, in several locations. This is the explanation that's been given, is that the program for performing these procedures was somehow overridden, resulting in an 8 times greater radiation dose than had been expected. These individuals who had been evaluated for strokes actually came back complaining of hair loss, and that was what resulted in the initial assessment of what could have happened to them that resulted in this finding of excessive radiation dose. Apparently there was a misunderstanding about the default setting on the machines, and the protocol that was used or the imaging technique that was used resulted in a higher than anticipated radiation dose. Unfortunately, few physicians are aware of the radiation levels delivered during medical imaging tests. In part, this is because of the basic radiologic information is difficult to find and to understand. As I've indicated and referred to you before, sort of refer to this as radiology alphabet soup. You have the Röntgen, you have the rad, you have the REM, you have the gray, you have the sievert. If you mix and match all those things, it's difficult to compare. It's difficult for people to understand. As this article points out, the obscure and non-standardized terminology makes it difficult for researchers, not to mention clinicians, or particularly non-healthcare professionals, to understand the dose and risks connected with these procedures. So, in this particular article, they advocate something called a radiological driver's license. It would be required before allowing for individuals to refer patients for imaging procedures or individuals to perform those procedures. So if you're a referring physician in this particular instance, you would basically have to pass a test that says, I know how to order these procedures safely. They even suggest that penalty points would be assessed for inappropriate referrals, and if those penalties rise to a certain level, then you would lose your privilege to refer patients for radiation procedures until you did subsequent continuing medical education and had your basic radiologic driver's license reimbursed. Similar to what happens in most states with a driver's license. If you get a certain number of loss of points for driving either too fast or with some type of difficulty, you'll lose points and you can ultimately lose your license. Then you can gain it back in some instances by taking courses and getting those points reduced. The same type of thing would apply for radiation procedures. They also suggest that every scientific paper dealing with radiology should include a table that describes all the tests performed in the study and the cumulative radiation exposure absorbed by the study population. They feel that this would help individuals who are reading about radiation studies to understand that there is some risk. And they go farther by stating that they believe that patients should have to sign an informed consent for radiation procedures, so that they understand that when they're having these radiation procedures performed, there is some risk, and it would also influence them not to insist on having these exams. Because one of the big problems in these radiation studies is that patients sometimes insist on having some type of X-ray examination performed. A lot of times that's because they don't understand that there can be some risk associated with these procedures. So, one of the things that we need to remember is that x-rays in general are very helpful. CT scans have prevented more unnecessary surgery than probably any technology ever invented. If x-rays or CT scans are necessary, we want to get the right test and we want to get it the first time. We don't want to perform more x-rays than are necessary. And CT scans, we want to remember, deliver a relatively higher dose of ionizing radiation. So we want to image these individuals very carefully and very gently. Image Gently is an alliance for radiation safety and pediatric imaging. It's a coalition of 29 organizations dedicated to reducing medical radiation in children. It's free to join. All you have to go is to their website, www.imagegently.org, and sign up and take a pledge, a very simple pledge. It only takes you a few minutes to basically say that you will support limiting radiation dose in children as much as possible to try to protect these individuals to the extent that's reasonable. And this is something that they will also allow you access to protocols that show you how to reduce the radiation dose in individuals so you can keep the dose as low as possible. There's also an organization for keeping the radiation dose as low as possible in adults. This is referred to as Image Wisely. Image Wisely is an awareness program of the American College of Radiology, the Radiologic Society of North America, the American Association of Physics and Medicine, and the American Society of Radiologic Technologists. Image Wisely's objective is to encourage practitioners to avoid unnecessary ionizing radiation scans and to use the lowest optimal radiation dose as is required for these studies. Now, just a note on what we might see in the future. This is a study that was conducted using the flagella of benign salmonella bacteria that normally live in our intestines. So all of us, I think, are aware that within our intestinal system we have bacteria that help us break down food and those types of things. It turns out that there's a particular type of salmonella bacteria that actually helps keep cells alive. They live on and around the cells that are in the GI tract, and they help keep those cells alive and promote health in those cells because they live off of those cells. The flagellum is the tail. It's the tail of this bacteria. And a drug has been derived from the flagellum, or the tail of this bacteria. When combined with a carrier molecule, and the code number of the drug you can see here. But the point is that when that drug is injected into mice an hour or less before they receive 13 grays of radiation, a dose that would be fatal to most humans, the salmonella drug kept 90% of the mice from dying, and it protected both their GI and their bone marrow cells. So it's conceivable that in the future, when you go for your radiation procedure, you may take a pill and you'll have some protection, perhaps a very significant amount of protection from radiation. But until that day, we want to remember that patient radiation safety is a very important issue, particularly for high-dose procedures. We need physicians and patients to be informed. It's very important to maintain perspective, though, because these procedures are necessary and important in many patients. We want to use them, but we want to use them wisely and we want to use them safely. When a CT or other X-ray is needed, we want to do it, but we want to limit the radiation dose as much as we can. We also want to always image gently and always image wisely. Thank you.